Hi, everyone. I'm Diane Austin. I'm the CEO and co-founder of Coils to Locs Wigs, and I am here with my co-founder and sister, Pamela.
Hi, everyone. I'm Pamela, president and co-founder of Coils to Locs.
And we are really delighted to have Dr. Melanie Whitten with us on this recording video today because Dr. Whitten works in the oncology space and she offers a really interesting clinical perspective on the patient experience directly related to chemotherapy hair loss that we think is important for people to know about. So, Dr. Whitten, we really appreciate you joining us.
Well, of course, not a problem at all, Diane and Pamela. It's actually my pleasure to be speaking with you guys on such an important topic.
Thank you. So, I thought we'd start with just having you share a little bit about your background and the population that you serve.
Okay. So, I'm a breast surgical oncologist. So, what that means is I treat both malignant breast cancer, but my specialty is I'm sorry, both benign and malignant breast disease, but my specialty is breast cancer specifically.
Well, thank you for the work that you do as a breast cancer survivor. I feel just so fortunate to have had a wonderful team of clinicians who, not only found the cancer and found it early, but treated me. And I know this is not easy work, so thank you.
Oh, not a problem at all. Thank you for doing something for seeing a need and actually acting on it. Because a lot of people say they're like, oh, we need to do something, we need to do this, or I want to do this, and nothing actually ever happens. So the fact that you took this and ran with it is amazing. So thank you.
Thank you.
Oh, thank you. We appreciate you saying that because we do hear that a lot. The thank yous and the people, who have had, some sort of thought around this needs to happen. And they've been forthright in saying, we knew this needed to happen, but either didn't know how to go about it or just didn't take the initiative to make something happen. So we appreciate you saying so. Thank you.
Yeah. So before I jump into my next question, Dr. Whitten, I do want to share with the audience who may not be familiar with Coils to Locs and the Coils to Locs journey, just what we're all about and how we got started in the business of providing coily, curly wigs to Black women, brown women who are suffering from chemotherapy hair loss and who want an alternative wig other than a straight haired wig that they can purchase in a cancer center boutique and get all of the associated care related to being able to get a wig where you're being cared for, or in a space where they recognize the sensitivity in terms of caring for cancer patients who are interested in wigs. Just really started from my journey as a breast cancer survivor. And when I was told by my oncologist that I was going to lose all of my hair, I was given a wig prescription and told, go to any cancer center boutique, even at the hospital where I was being treated, and you can get a wig. But I was really surprised in 2015 that I was not able to get a wig that looked like my coily, curly, kinky hair. I like to say kinky hair, lovingly, that I could purchase with my health insurance because I had health insurance that covered the cost of the wig. And I know, I am very blessed to have really good health insurance. And I know that's not something that everyone has, but it was very upsetting to me to not be able to use that health insurance because everywhere I went, no one had any wigs that looked like my hair. They only had straight haired wigs. And I was told to, well, you can buy the wig and then take it to this a recommended salon and they could put chemicals in it to kink up the wig. Or there was misunderstandings about what I meant by, I was using every descriptor, Afro kinky, Afro curly, coily curly, just to make sure that people understood what I was talking about. And so, I went to one salon, cancer center boutique, where was told that prior to getting there, but they did have wigs, the types of wigs that I was looking for. But when I got there, what they actually had was a line of wigs by a Black, a celebrity who had a wig line. I won't say the name. Um, but she didn't have any curly wigs. But there was a disconnect for them because I think they just heard, Black woman who wants a wig, and they directed me to this wig line that didn't have curly wigs, but it was a wig line by a Black woman. So it was just a very frustrating process, and it prompted me to want to disrupt that process by making a difference and for myself and other women
Yeah.
by starting this company.
And addressing that healthcare disparity, which is what it is.
Yeah, it really is.
Mhm.
So my question, Dr. Whitten, to you is, the chemotherapy-induced hair loss for many women um, is traumatic, and some women are fine with going without a wig, while other women, they want a wig and they want something that oftentimes resembles the hair that they lost. And I have found that um, those who are running some of the cancer center boutiques and hair loss salons and just other individuals in the space don't always recognize why it's important to women like myself and to find a wig that looks like their hair, and that it's more than just sort of a vanity type of purchase. So can you share from your perspective as a physician who works with cancer patients why finding a wig that is culturally relatable is equally as important for patients of color?
So my goal when I am treating patients is to make their lives as normal as humanly possible. Cancer takes away so much, especially like with breast cancer with women, like it's affecting the things that make you a woman, for society standards, like it's affecting your breasts, and then it's going to affect your hair. And so it takes so much. And what I want to do is be able to give you something back so that when you look in the mirror, when you're going to the store, no one's wondering what's wrong, and you're not being looked at any differently than anyone else, because the semblance of normalcy is really important. It really does affect your psyche, and it affects how you heal. It affects how you see yourself. It affects how others see you, which everyone says like, oh, I don't care what people think. We do care. Everyone cares.
Exactly.
And most importantly, you care how you look when you look in the mirror. In my office, we actually have mirrors in the office. So people can, like, if something's up with their wig, so they can adjust themselves before they walk out the door, because a lot of our patients are wearing wigs. So it actually is just as important as the medicine that we're giving you in the fight to getting you back to normal, getting you back to that's all a part of survivorship, because most women with breast cancer, most women live. And with all types of cancers, we're giving you medicine. The whole point of giving you chemotherapy is so that you live. But if your quality of life is poor, then what's the purpose? Like, what have we done? And so if we can give you some type of adjunct to help with your quality of life, then that means a lot. And if you can actually get a wig that looks like you, that looks like something that you would wear, that if you saw someone that you hadn't seen in a couple of years, they would have no idea, because you look like you. Diane looks like Diane. Like, and so there's not like, oh girl, what happened to you? And then you have to explain it to someone else and go through that trauma again. But if you just look like yourself, that's a topic that you don't go through. And the repeated trauma that you don't have to repeat again for someone who probably doesn't even matter, to be honest. So it's very important to me that women of all different shades and women of all different colors and ethnicities have wigs that match what they would normally wear.
Wow, we were both smiling and nodding constantly with everything that you were saying, because there was, you said so many key and important things, but I know, one of the important things for Diane, if I may speak for you, is that
Okay.
is that she didn't get a lot of questions, and that people weren't asking her because they saw this drastic change
Yeah.
in her hair or whatever. Oh, what's wrong? Or, oh, your hair's different or whatever. So she would have to, explain what that was. And she didn't want any of that. I know that how important that was for Diane to
Yes,
look
it was
and look
a
like
big,
this.
yes, a big concern for me that I didn't want to attract attention to myself.
Mhm.
And I wanted some control over the way that I looked because so much was not in my control. And chemotherapy has causes so many debilitating physical effects from, both internally and externally, that to be able to just look like myself was really important.
Mhm.
Exactly.
Yep.
What are some of the challenges or just general feedback that you've heard from Black and Brown patients who are seeking wigs due to medical hair loss? Um, and then what concerns or challenges have you faced as a physician supporting your patients through this part of their cancer journey as well?
Finding a wig is incredibly difficult. And it's not just for women of color, just finding a wig in general has been incredibly difficult for all of my patients. The hospital I worked, they did not have, they had a cancer wellness center, but they did not provide wigs. And my hospital was south of a major metropolitan area that no one wanted to drive into. So, so their insurance could pay for it if they actually went to the center in the city. And no one was willing to do that. And so they were just like, screw it, I'll just go without. And they didn't want to go through, like you said, buying the wig and then getting your insurance to pay for the wig that you already purchased. So that's step one, like finding a wig, period, was difficult. And even I started going into, but I did notice that my patients of color often did not wear wigs versus my white patients. So what I started doing was going to wig shops myself just to see, so I could tell them what's there. And so I would go into a store and just see white woman wigs, like these bone straight wigs. And I would go in there and I would say, hey, do you have any hair like me? And then that get this confused look. And they would point to like a really curly white woman wig. That's nothing like it. And that would honestly look ridiculous on a Black woman. Like, it's like, no, that doesn't look like her hair at all. If that's what she wants to rock it. But it doesn't look real. And I would like say, well, this is a population that you're missing, just in general. Like, you're missing out on a population, and you're especially like, this is my patient's community, and you're making this especially vulnerable for my patients who live and work here. Like, this is where they're going, and you have nothing. So it was incredibly disappointing, which is why, like, I just think it was divine intervention that I happened to be home when you guys were on the Today Show, and I was like, oh my God, like, I finally have something for my patients that they can utilize, because it's been so difficult. Like, it's really been hard to find anything for them.
Yeah, there are no accidents. Yes, there was a reason why you're home.
Exactly.
Yeah, and it's amazing too. Again, we often talk about the conscious and the unconscious biases and things like that in terms of that, because it's, what we found in a lot of instances is that we're just not even on their radar,
Mhm.
in terms of that need. Because as you know, based on what you were even just saying, like a straight haired wig for a Black woman is different than a straight haired, a European woman's straight hair. It's a
Mhm.
different look. So
It's a different look.
even
Yeah.
if they want a straight haired wig, that's a different look,
My hair straight looks different than a European woman's hair straight.
Absolutely.
It's completely different. So if I wore a straight hair wig, it's obvious that I'm wearing a wig.
Hmm.
That's amazing. You were going to the beauty supply stores and doing that
Yes.
advocacy work and confronting some people, letting them know, what they were missing. Do you have just any closing thoughts or advice for clinicians or those in the cancer resource space and uh, patients that you like to share? All those people. Any advice or thought?
My only advice would be listen to what they're saying, listen to your patients, listen to what they're saying, and also listen to what they're not saying. Like, pick up on body language, see if they are comfortable. Some women are completely comfortable not wearing anything at all, and some aren't. But we can pick up on those signs, and they're not necessarily even subtle. Like, if they're looking uncomfortable, if they're constantly like checking their head, things like that, it's like, okay, is there a different process that you need? Like, what do you need for me to do? How can I help you with this? Because we aren't just physicians, and we all know this. We're not just physicians of like, I'm not just a breast doctor. I'm an entire body doctor, because when your whole body is something's up, then we need to address that, because you're not fully whole till everything's okay. And so we just need to listen to our patients and do what we can to make sure that our patients are fully whole, to make sure that once they are this journey, it's going to be hard enough with the things that we give them, like that it can be, we can make the so-called little things better, because it can't, chemo sucks. Chemo's not fun for anybody. And if you compound that to, I can't even find a wig for myself, it's like, well, now we just add it on. So if we can do everything we can to alleviate those situations, that would go so much better.
Definitely, and that's why our tagline is more than just a wig. It's more than just a wig. It's addressing so many needs, you know, small and large, for that patient. So,
Absolutely. And we really appreciate your time, Dr. Whitten, and you hit on so many major points from, through the lens of a physician that I think is important for people to know. I've shared with individuals that even in the cancer center retail space, we've had people say, who are considering our wigs, well, can't these patients just get a wig like this at a beauty supply store? There's this disconnect that, well, maybe they could, but why should they? Are you saying the same things for the patients who want straight haired wigs? Like, why should it be a different pathway, a different journey for women? You
exactly.
within a
Because
cancer.
they're making that statement, if I may jump in there, while they're surrounded by European hair wigs in their cancer center space. Well,
Yeah,
can't those women do the same thing? But
yeah,
If they
that's
feel that way, then why are they supply wigs at all?
right, exactly. So
Like,
there's
don't do
this
one person and not the other. That's the
exactly,
disparities that you've been talking about, Pamela. Like, it's
yeah.
yeah. So we're doing a lot of education in the work that we do in terms of, yes, we're a social impact business, we're a for-profit business, but that social impact piece is important to us. And part of the work that we're doing is really educating one vendor at a time as to why this is important. So we really appreciate your perspective and your time. Thank you so much.
oh, it's
And
not a problem at all.
Thank you
Thank
so
you
much.
guys for doing this. This has been wonderful.
welcome.
No, thank you. We appreciate you. Thank you so much.